infection. First, we know that microorganisms are ubiquitous, it's present everywhere. Microorganisms are agent of contamination, infection, and decay, hence necessary to remove them from materials and the area. First, what is sterilization? Sterilization is a process by which all living microorganisms, including viable spores, are destroyed from an article, body surfaces, or medium. It can be achieved by two methods: physical method of sterilization and chemical method of sterilization. Then, the next terminology is disinfection. Disinfection is complete removal microorganism except the spores. Then what is disinfectant? Disinfectant means is an agent used to is an agent. Disinfection can also be achieved by physical agent or chemical agent. Is commonly called as disinfectants. They are normally used only in inanimate objects, not on body surfaces. Then methods of sterilization. There are mainly two types of methods: physical and chemical methods. In physical methods, heat, radiations, and filtration methods are there. In heating method, dry heat and moisty is the important type of methods. In dry heating, in dental industry, hot air oven is the main example of dry heat sterilization, and it is also incineration, flaming. It also comes under dry heat sterilization method. Then moist heat sterilization, autoclave is the best example. In radiation, UV radiations and X-ray radiations are there. In filtration, two types of filtration methods are there: air and liquid filters. Then in chemical agents, mainly used in two forms: gaseous and liquid forms. In gaseous, sterilization is mainly used in formaldehyde gas and hydrogen peroxide gas. In liquid, liquid example: alcohol, phenols, aldehydes, biguanide, these etc. Then physical method. In physical method, sunlight, drying, heating, radiations, and filtrations are there. In dry heat method, the main examples of incineration, red hot and flaming, and hot air oven. It kills the organism by charring, is denaturation of bacterial protein, oxidative damage by toxic effect of elevated level of electrolyte. Then what is incineration? Incineration is used for disposal of biomedical waste material. It's produce high heat, very high temperature, around 870 degree to 102 degrees Celsius heat. It's burned to ashes. Then red heat. Inoculation loop or wire, tips of forceps and spatula are held in a Bunsen burner till they are red hot. Then next important instrument is hot air oven. It's mainly used in microbiological labs. It is electrically heated. It's contained fan to ensure the adequate and even distribution of hot air in the chamber. The temperature is 160 degrees Celsius for 2 hours. And then the glasswares like syringes, petri dish, petri plate, flask, pipettes, these materials are sterilized. In surgical instruments like forceps, scalpels, these materials are sterilized. The biological control is Bacillus arthrophis. Then moist heat method. Moist heat method is kills organism by hot air or steam. It is also called a steam under pressure. Its mode of action is denature and coagulating their proteins, and it's a high penetrating power. Moist heat sterilization is carried out several methods: temperature below 100, temperature at 100, and temperature above 100. In temperature below 100, pasteurization, incipitization, and vaccine bath are there. Temperature at 100, boiling water, tendalization, and a couch. Temperature above 100 degrees Celsius is important in dentistry, is an autoclave. In the first temperature below 100 degrees Celsius, it's many heat labile fluids like body serums, body fluids, vaccines, etc. It kills most of the mesophilic organism. And then next, pasteurization. This method is used for control of microorganisms from beverages like fruit and vegetable juice, beer and dairy product. Then there's a holding method and flash method are there. Holding method is 63 degrees Celsius for 30 minutes. Flash method is only a fraction of seconds is rapidly cooling the material. Then water bath. Water bath is mainly used for the disinfection of serum, body fluids and vaccine. Then incipation. It is a intermittent heating method sterilized by heating at 80 to 85 degrees Celsius for 30 minutes for 3 consecutive days. The instrument is incipient. It is mainly used for egg and serum based medium. Then temperature at 100 degrees Celsius. Boiling is the important method. Is boiling method temperature is 100 degrees Celsius. This kills most of the vegetative organism. Tendalization. Tendalization is similar to that of incipation. Is a 3 consecutive days 85 to 100 degrees Celsius is the incipation. Above 100 degrees Celsius is the tendalization. Then steaming. Koch or Arnold sterilization are mainly used for autoclaving. Then most of the vegetative forms are killed except thermophils and spores. Then important instrument is autoclave. It is mainly used in dental practices and dental clinics. It's work on the principle of steam under pressure. When water is heated in a closed environment, its boiling point is raised along with the increase in the temperature of generated steam. When steam comes in contact with cooler surfaces, it condenses to water and give up its latent heat to the surfaces. It is its great penetrating power and high lethal action. So most of the dental instruments such as hand pieces, saliva evacuator, high melting plastic zones of polishing, sharpening, and orthodontics pillars. Okay, or all examples. These instruments are mainly sterilized by autoclaving method. Then two types of autoclaves are there, vertical and horizontal. One end has opening means of keep material to be sterilized. The lid is provided with pressure gauge. Then safety valve is there to permit escape of steam from the chamber. The sterilization temperature is 121 degrees Celsius for 15 minutes. Then two types of autoclaves are there, pre-vacuum autoclaves and a gravity displacement autoclave. Gravity displacement autoclave is also known as benchtop autoclave. It is mainly used in dentistry. Then sterilization control. Sterilization biological control is baseless stereothermophilus. It is also called a geobaseless stereothermophilus. Then another method is Brown's tube. It's a red solution. If the proper sterilization means red turns to green color. Then thermocouples and autoclave tapes, digital displays are placed. Then radiation. Two types of radiations are used, ionizing and non-ionizing radiation. In ionizing radiation, example infrared and UV rays, it's most of the vegetative bacteria are susceptible. The main mode of action is damage DNA by formation of thymine-dimer bond, inhibition of DNA replication. It is mainly used in rapid mass sterilization of pre-packed syringes and catheters, hospital ward, operation theaters, and lab. Then ionizing radiation, cosmic rays and gamma rays and X-rays are the ionizing radiation. It is a cold temperature sterilization method. It's high penetrating power. DNA damage without raising temperature. Then filtration. Filtration is an excellent way to remove the microbial population in solution of heat-labile materials like vaccines, antibiotic toxins, serum, etc. Two types of filtrations are there, depth filters and membrane filters. In depth filters, porous filters that retain particles throughout the depth of the filter that just on the surfaces. They are commonly used to filter high-load particles, mainly in industrial purposes. For three types of depth filters are there, candle filters, asbestos filters, and cinder glass filters. Then the membrane filter is the most widely used bacterial filtration. It's retain all the particles on the surfaces that are larger than the pore size. Then filtrations of liquid. It is mainly used to filter the sera, sugar and antibiotic solution. In filtration of air, two types of filtrations in air are used: HEPA filters and ULPA filters. Then disinfection. Disinfection is an agent, usually a chemical to kill to grow the inhibit the growth of organism. Mainly three levels of disinfectant are there: low level, intermediate and high level disinfectant. In low level disinfectant, that means alcohol based materials, ethanol, isopropanol and methyl alcohol is mainly in alcohol form. Ethyl alcohol is mainly used in surgical spirit and hand rub and antiseptic. Isopropyl is clinical thermometer and small instrument soaking in isopropyl alcohol for 10 to 15 minutes. Methyl alcohol is effective against fungal spores and disinfection of cabinet, incubators and injuries to eye. Then aldehydes, three types of aldehydes: formaldehyde, glutaraldehyde, orthophthalmaldehyde. It is a sporicidal effect. It is a high level disinfectant. Formaldehyde are mainly used for the preservation of anatomical specimen. Then formaldehyde gas is used for the fumigation of operation theatre. Then glutaraldehyde is less toxic and less irritant and less corrosive. Hence, it is best used to sterilize hospital, laboratory equipment such as endoscope and cystoscope. The 2% Sidex disinfectant is mainly used. Then it is mainly used to clean sensitive instruments like cystoscope, bronchoscopes mainly in dental orthodontics pillars and orthodontics kits mainly sterilized. Then orthophthalmaldehyde, it is mainly used for the sterilization of endoscopes and cystoscope. It is a microspecial activity. Then phenolic compound. Cell membrane damage causes lysis, low concentration of phenol precipitate protein, inactivate membrane blood oxidase. These are the activities. The phenol acts as a disinfectant and antiseptic. The disinfectant means cresol, xylol, lysol of orthophenol phenol. As the example, the phenol as a disinfectant means a lysol. It's a cleaning floor, disinfection of surgical instrument, disinfection of furniture, tables, and contaminated objects. Then phenol acts as an antiseptic. That means Dettol, hexachlorophene, chlorhexidine, triclosan. These are the example. Then bignite. Bignite is a chlorhexidine gluconate. Is mainly widely used in disinfection. Is commonly used for the surgical and dental antiseptic. It is the content of mouthwash. Then halogens. Halogens contain iodines and chlorine. Iodine is a skin antiseptic and it kills microorganisms by oxidative cell constituent and iodinating cell proteins. And then chlorine. Chlorine is mainly used in water purification companies. Chlorine gas and sodium hypochlorite, calcium hypochlorites forms are available. It's mainly used in the disinfectant water supply, swimming pools, dairy equipments, and food industries. Then oxidase agent, hydrogen peroxide is the important high-level disinfectant. It is a high lethal action and it attacks membrane, DNA, and other cellular component. It is mainly used in plasma sterilization. Then paracetic acid. Paracetic acid is also a high-level disinfectant, non-toxic end product. Then it is mainly used in plasma sterilization in surgical instrument. What is plasma sterilization means? Plasma refers to a gaseous state consist of ions, photons and free electrons and uncharged particles. It's to create a plasma state. First the chamber is evacuated to create a vacuum. Next the injection of chemical sterilant such as hydrogen peroxide and paracetic acid are used to sterilize. It is mainly used for the sterilization of plastic, electrical devices, corrosion susceptible metal alloys are mainly used. Then heavy metals: mercury, silver, arsenic, zinc and coppers are the examples of heavy metals. It's mainly used by the fungicide and lacs and swimming pools. And then cationic surface active agent, it is effective disinfectants including quaternary ammonium compounds, skin antiseptic, small instrument, food utensils, etc. Then anionic surface active elements include soap, active, acidic pH, strong detergent. It is a weakly antimicrobial property, more effective against gram-positive negative bacteria and gram-positive bacteria. Then dyes. Aniline and acrylic dyes are the two examples of dyes. Then gaseous ethylene oxide is important gaseous sterilization. It is mainly used in the sterilization technique. It's a high-level disinfectant method. Ethylene oxide has a both microbicidal and sporicidal effect. The instrument name is ethylene oxidizer. And it is mainly used for the sterilization of heat-sensitive items such as disposable plastic petri plates, syringes, heart-lung machine component, catheters, respirators, and dental equipments. Then low-level steam formaldehyde, low temperature, is a hydrogen peroxide fogging. It is mainly used in the fumigation of operation theatre. Formaldehyde such as potassium permanganate solution in formalin mainly used. Atom should be sealed for 48 hours. And the better method of replacing fumigation hydrogen peroxide fogging. Beta lactam is used in older days, but it is not used now because it is carcinogenic effect. Then spouting classification. Patient care items categorized as critical, semi-critical and non-critical items. Any critical items means it is penetrate soft tissue, contact bone, contact enter into bloodstream or other normally sterile tissues of mouth, surgical instruments, scalp, surgical, dental burrs, etc. Semi-critical items means mouth mirror, amalgam condenser, reusable dental impression tray, dental hand pieces. It is a high-level disinfectant. Non-critical level is contact with intact skin, blood pressure cuffs, stethoscope, etc. Then commonly used disinfectant in dental practice is the mainly used in the most effective method is autoclaving technique. The disinfectant means alcohol, aldehyde, bentonite, halogen, phenols are mainly used in dental practices. Thank you.